My name is Shelby Loane, and in this video, I'll be relating back to our topic this week of therapeutic foster care through the article that I found online. The article I selected is entitled Service, Process, and Quality in Therapeutic Foster Care, an Exploratory Study on One County System. This article is part of a journal that is part of the Journal of Social Service Research and was written by Thomas Pavko, Richard Hugg, Irene Lurie, and Susan Nagash. After reading the chapter, I was interested to look into therapeutic foster care. In the article, they define therapeutic foster care, or TFC, as a specialized foster care program engendered to serve youth with mental, physical, emotional, and behavioral challenges. This is different from regular foster care because it focuses its service terms more on equipping foster parents with the means needed to address the mental health challenges that the youth in TFC may have. TFC can also be referred to as specialized foster care, treatment foster care, multidimensional treatment foster care, or foster family-based treatment. When looking into TFC, I feel it is a treatment process for foster care and the children. The people working in this program look to develop therapeutic goals and treatment plans for the children involved. It's stated in the article in 2007 that there was an estimated 783,000 children served by foster care agencies. When you look at that many kids, it is crazy to think that many did not receive the proper help needed. The article discusses a survey that was conducted from June to November of 2005. This survey looked at 67 randomly selected cases of children that had been placed by the TFC program. There was a total of 7 licensed child placing agencies, or LCPAs, involved. Of the sample tested, the ages of the children tested were broken into 4 age groups. 24% of the children were up to 4 years old. 28% fell between 5 to 9 years old. Around 27 were between 10 to 14 years old. And 21% were between 15 to 19 years old. The cases looked at were pretty gender neutral, with 54% male and 46% female. Though the cases looked at was not divided when it came to race. This survey was made up of 76% African American, 18.5% Caucasian, 3.7% Hispanic origin, and 1.9% biracial. This survey also had 33% that had a presence of medical condition involved, and 45% with a learning disability or developmental delay. The teams that looked into TFC agencies used 2 different review tools. They used the TFC Quality Assurance Client Review Form, or CRF, and the TFC Program Review Form, or PRF. Through these, they focused on 11 areas when using these forms. Some of the things they looked into included organization of service provisions and treatment planning, assessment practices, medications issued, and the issues with giving those medications, aftercare planning, permanency and reunification issues, provision of education services, foster parents, and the homes that the children were provided. But by what I found, the teams went through 9-step processes to get these results. First, the project managers set a date for teams to complete the visit to the LCPAs. The second step, the review team met with the LCPA administrators to understand their program structure. The third step was having the review team look at a randomly selected 20% of the LCPA's cases. In the fourth step, the reviewers looked at key people involved in the cases and conducted interviews with each of them. The fifth step involved interviewing appropriate age children that were involved in each case. In the sixth stage, reviewers created comprehensive charts that reviewed everything they found, from reviewed treatment plans, progress notes, and educational plans. The seventh stage was completed through the reviewers finishing the CRF and CPR forms. Step 8 consisted of reviewers completing reports that listed the LCPA's strengths and challenges. To finish this stage, the formal written report is forwarded to the DCS office within 10 days. The final stage involves the reviewers verbally addressing the DCS office about any cases where the child's current safety or well-being is endangered. I was really amazed at the problems found from this study. 43% of the children were not receiving proper assessments when it came to comprehension development, physical, psychological, and health assessments. Health assessments alone are supposed to be reported within 30 days of involvement. And in some reports that were found, foster children had to wait a year to be seen by a health provider. I think that's way too long. Within the 30 days, many of these kids did not get the proper treatment they needed because of that. As I tell you some of the many problems found in this survey, I want you to remember the long-term effects that the quality of the TFC program can have on adults that were involved in the program as a child. Some of the problems that really stood out to me in this survey included: therapy did not match the requirements in 29% of the cases looked at. In 37% of the cases, the therapist given to each family did not have a master's degree or a state license. A major thing that blew my mind was the medication issues among cases. Only about half of the cases had documentation of the changes and effects of medication of the children in those cases. Not all foster parents and even case managers knew the child's medications that were needed. When asked to show documentation of dosage, time and date, and who gave the child medications, only 30% of foster caregivers could provide this. In my opinion, this is not okay. Medication is not something to take lightly, and in cases of children that are severely troubled and rely on this medication, not having documentation of what you gave them, who gave it, is not legal. I also was shocked that LCPAs were not involved in the reunification process of the children. It stated that some were, but in most cases, they had nothing to do with reunification. One field that foster parents did excel in was the educational issues. Over 3/4 of the foster parents that were reviewed in this case had documentation of previous education experiences that the children they were watching had. And almost 90% had documentation of their foster child's process currently. In the foster homes, parents did meet the square footage requirements at 86% of the cases. Even better, 95% had the required 2 exits in the foster children's rooms. I was amazed, though, at the option to override certain rules when it came to foster homes and the number of children in the home. Around half of all the homes looked at had proper requirements like plug-ins covered, first aid kits available, and emergency phone numbers posted. Only half. Sticking with that, only 48% met the requirements to have no more than 2 TFC children in the home. To me, if you're going to have rules, it is hard to understand why only half of all the homes tested are meeting these rules. If they are allowed to be exempted from these rules, it was not documented. They found that only 18% had documentation to match their failed requirement. I was also amazed that not all foster parents met the training requirements needed to be foster parents. Only 36% had cultural competence training, and only 52% had the educational surrogate training to help the kids that might not have the proper and need extra educational training outside of school. Finally, case managers really did not know that much about their cases. They had 96% rate of visiting the home, but what good does that do if you visit the home and don't know each case and the people involved? That visit's simply just going to be a stopping by to check a mark on a paper, not watching for things that need to be looked at. Only 45% of cases had a DCS plan involved. The LCPAs only sent monthly reviews to 57% of the cases to the case managers, with only 25% of those incident reports being sent to those reviews. And finally, only 53% of the DCS case managers knew of the medications needed for the children that were involved in their cases. TFC is supposed to be put into place to help the children and families involved. But how is this supposed to be done if the evidence-based model, program models, documentation, and overall program focus is not completed in each case? The TFC observed by the evaluators in the study did not measure up to either set of standards that TFC stands for. Some programs did not have proper administration, resources, or even training for both the people involved watching the children and the programs that were put in place. They also found that weaknesses in assessments and treatment planning were major factors in failing the children. Therapeutic foster care programs really need to be looked at to make sure that they are really upholding what they are supposed to in the effort to give the best care to the children involved. Without this, many of the therapeutic programs are not therapeutic at all. The children involved are supposed to be in these programs because they need extra care compared to just regular foster care. And when you're not upholding all of these regulations and requirements, you're not meeting the needs of those kids. They have extra needs and it's not getting met. With that, I have developed a couple questions to get this discussion going. First off, what do you think therapeutic foster care is? Just tell me in your words from the chapter and what we've learned so far in my article, what you feel the therapeutic foster care is. Also, for the second question, do you feel there are linkages between service quality and treatment options? If you do, list some of them. If not, tell me why. Thinking on the requirements of foster families, the third question is, what are a few more requirements in your state that have to be upheld by foster parents? The fourth question, with your knowledge on this survey, what do you feel needs to be done to improve TFCs like the one discussed in this article? Finally, the fifth question, have any of you had experience with therapeutic foster care or know someone who has been a part of it? And that's it. Thank you.